Welcome to the Sustainable Clinical Medicine podcast. I am your host, Sarah Smith. I am a practicing rural family physician and the charting coach. This is the podcast for physicians and advanced practice providers who are ready to step back from the busyness of their clinical day to share ideas, question everything, and redesign their clinical day. We are redesigning clinical medicine to create sustainable clinical days and create time for our lives outside of medicine. Join us for discussions with world experts who are helping design sustainable models of clinical medicine and the physicians or clinicians who have discovered or designed sustainable models of clinical medicine for themselves. Hello, everybody, and welcome back. Today we have with us a special guest, Margie Sills-Maerov, who is an occupational therapist, and I had some interesting pre-conversation with her. I'm going to let you introduce yourself. Welcome.
Thank you so much. So I say occupational therapist with an asterisk because I haven't practiced in years, so no longer practicing, but certainly is part of my identity and who I am.
Yeah.
So I'm Margie. I live in Calgary, Alberta, Canada, otherwise known as Wilkinsis, which is Treaty 7 territory for the Blackfoot Confederacy, and the District 6 of the Métis Nation, and very honored to be on this land. And the work I do, so how would I describe myself? So I am an OT by background, and that is the heart. You and I chatted a little bit about how that is the heart of who I am. It's always about balancing, things like productivity, self-care, leisure. Those are key components of things you do in life, and everybody has their different balance. And how do you help people meet those? How do you help people meet their life so that they are balanced as individuals? And I think that follows through with everything I've done. I did an MBA. I got to work under the wonderful, late, great Brenda Zimmerman, who taught me about complexity theory and how human systems operate and human systems as complex adaptive systems. And she was a mathematician, and she looked at it both in healthcare, but also from a mathematical point of view. And so it was quite interesting to learn from her at that point in time in my life. And I'll tell you, only now am I understanding some of the things that she talked about. She was such a great teacher. And so that work kind of led me on a whole pathway of working in health systems, and not just how do I help individuals make change, but how do I help whole systems make change. And I did that in government, in doing quality improvement, in looking at frontline quality improvement. I worked in primary care for years and years as a clinical manager, certainly worked at it as in quality improvement and process improvement. And that really led me to a big question I had, which was, how do people make change? All those things throughout my whole career is about how do you help people make change so they can be the best version of themselves that they want to be.
Mm-hmm.
And if you look at the practice of medicine, say family practice, how many clinical practice guidelines are there? 900?
Yep.
Yeah. How many are followed regularly, and how often do you actually update them for yourself? It's a challenge.
Yeah. Mm-hmm.
And part of that, I'm like, well, why is that? It's not that these are people who don't want to do a good job. And, there is time in a day to reflect sometimes on that. At least there was. We'll get into that later. But there's the opportunity to think about, how do I do practice better? So all these well-intentioned people who aren't necessarily looking at that or using it, why? And I came across the concept of coaching, and coaching has a lot of connotations about it, and it's usually a sports model of coaching. But to me, coaching is about the thinking process, and how do you support people with their thinking processes so that ideas, be it a best practice guideline, a new process, a new working with a patient, implementing a plan for them, goes through their own filter and becomes theirs.
Mm-hmm.
And there's a process by which, and there's a best practice process to actually do that. And so I looked at coaching and how do I help? And I started taking coaching, and I'm like, okay, this is the stuff. This is how people will make change when they have time to think, reflect, and pull it into themselves. So I went on a journey where I just learned a lot about coaching, and my next phase of my career has been all around how do I bring the skills of it, even though it's called coaching, it's more just the skills of communication to help people internalize and make change and be self-directed.
Yeah. We were talking right before the podcast about what is an occupational therapist, and you said a system thinker, somebody who can think about a system. And we're talking about like the individual within a, an environment and helping them achieve what they need to achieve within this environment, either with something new that's happened to them, like a post-stroke, or just somebody who's wanting to try and make things better for themselves. And then we're talking about goal setting, and you said, I come in and help you go where you want to go.
Mm-hmm.
Like from an individual point of view, this was where the career had kind of started, was what do you want to achieve? Because I can then help you get there. And then that difference in what physicians or clinicians tend to do is we know where your diabetes needs to be, and we know the path to get there, and here's what you need to do, right? And the patient like, oh, I don't want to involve myself in any of that. I don't necessarily want that if that's what it takes to get there. And so it's this clash. And then you come and say, and I then helped health systems. And I'm like, I know there's some very different opinions about the goal in
Mm-hmm.
any system if there's more than one person, right? So you can ask a person what their goal is. But if you ask a system what their goal is, there's going to be a completely different conversation and a lot of
Oh,
different personalities.
yeah. Yes, and that plays out, right? Like it's interesting because it's a fractal pattern. So part of systems theory is understanding how small patterns replicate themselves in bigger patterns. So let's start at the clinical level, that clinical microsystem. Family physician who is having a conversation saying, okay, well, we just found out, yeah, you are for sure, we've confirmed you're diabetic. Here's what you need to do. I'm going to send you here, 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 and keep your hemoglobin A1Cs within this range. We're going to test you, come back in a couple of weeks, and we'll keep going. And the patient leaves, and they're like,
Yeah.
well, now here's the doctor who gets the directive from the ministry who says, this is what we want in a health system. You will do A, B, C, and D, and we're going to pay you this. And thank you very much. It's the same pattern.
Oh my gosh, it is.
So if you want to change the health system, you have to change the patterns where you have control. And so I always say to physicians, so I now teach physicians coaching skills. And it's not the skills of coaching to be a coach. It's the skills of coaching to change that environment. Sustainable medicine has an external environment. That's that government piece that can sometimes, and it's the funding, it's the team, it's the processes, it's the time. Those are the external components. There's this internal component, and it's the finding joy. It's the sense of feeling you can make a difference for people. It's how you can be efficacious in what you do as a physician with people who can be really challenging. It's how you feel connected to other people. It's how you also feel autonomous and self-directed. Those are all things you need internally to feel satisfied. And so how do I help physicians find that internal component? Because that internal impacts the external. Micro level impacts the macro level. And so it's been really interesting that as I teach physicians these skills, I actually do believe, and this may sound really lofty, I think if we get enough of a tipping point, it will change the health system.
Give us your
Because
vision. Tell us how that would play out. Tell us what you've observed that you think could help change that healthcare system.
okay, let's start the micro again. So
Yeah.
I always tell physicians, you should give medical advice. You have diabetes, and here's the typical pathway, and here's what helps people typically. Now, that's a lot of information for you. Now you switch to coaching. So that's the medical expert model.
Yes.
Transition. As you reflect on everything I just shared with you, what wonderings are you raising about how that applies for yourself? That's a coaching question. That's the doctor saying, I don't know what this means to you. I know what this means to me. I don't know what this means to you. And the patient then has the opportunity in the space to say, oh gosh, well, I don't know how much I can change my diet because my family likes to eat this way. I'm not sure what this even means for me right now. I feel like I need more education. And
Mm-hmm.
the doctor paraphrases. So you're still feeling a little lost, but you already have some inklings that maybe there might be some challenges for you. Yes, yes. Okay, so here's what we could do.
Mm-hmm.
How does that sit for you? Very simple, but it's understanding when to wear what hat. Now, enough doctors do that. You start to see a pattern. If doctors do it with patients, they start to do it with each other. They start to do it in team meetings. They start to do it in meetings they have in government. Now, all those interactions, systems theory tells us small changes have a big ripple impact. Now, I'm not saying you're going to totally change the system overnight, but you
Yeah.
start where you have control.
Right.
And what we have found is that physicians who take this course, it was interesting because we started with it and we knew we were onto something because physicians
Mm-hmm.
would come back and like, this has changed my life. I don't know, I can't articulate how and why, but I'm feeling happy again.
Mm-hmm.
And one physician came up to me and said, you know, all of a sudden I'm not working as hard as my patients.
Mm-hmm.
I used to work harder than them, and now I'm not doing that. It's back on them.
Mm-hmm.
Because the gift you're giving patients is the gift of being autonomous, feeling connected to you because you're present
Mm-hmm.
and listening to their intake on things. And you're helping them to feel like they're really good at something. That stuff spreads.
Mm-hmm.
So when physicians would come back and they'd said, you know what, like this is actually, it's making a big difference in my life. One physician came back and said, those 15% of patients that I always struggled with, I'm no longer struggling with anymore. Or another one came back and said, I just had the most impactful conversation with my kids that I've had in my life by using these skills. Like these are all things that create that internal environment of sustainable medicine. It's how you actually find the joy again in spite of everything going on.
Got it. Okay. So we're taking these skills of expert opinion and then the that motivational health interview style, which is like coaching, right? It's that um, CPD for patients, cognitive behavioral therapy, a
Yeah.
little bit
And
about what could you start with today? What looks easy about this? What one thing have you heard me say that you think you could implement? Piece and
mhm,
letting the patient start being successful in the area that they want to start in and then seeing how that's going rather than us being tied to they must do everything they say
yeah. And
or I can't understand why they just won't take my advice
yeah.
or those frustrations that we have held on behalf
Mhm,
of the patient for so long. But then you're taking these skills of conversation with patients and you're saying, let's do this with each other. Let's listen and hear what are they frustrated about? What are they trying to achieve that they're not? And have these similar conversations with peers
mm,
or a
mm,
similar conversation with myself.
yeah. Yes. Because very rarely do physicians get the opportunity to work on that internal environment. It's always the external stuff.
Mm-hmm.
And at the core, one aspect we do in our program is we actually talk about physician identity. And who are you as a physician? And how have these skills added to you, not added? How do they impact your sense of identity as a physician? Because we tend to just go to, you're right, CBT, um, or any kind of motivational interviewing, those are all, they're typically frameworks. There's some
Mm,
distinctions. So one is that framework is typically rooted in health. Like I still know where you need to go.
that's right. Yes, you're right. It does definitely have that piece kept to it.
If you were to really be truly patient centered, it's here's medical advice. Where you go is up to you.
Mm, mm,
That's not your life is not my decision. And how had that fit into the identity? How does that fit into the identity as a physician and as a physician partner with patients. And that is something that is fundamentally very, very rarely spoken about or talked about for physicians. And when you explore it, the rationality of it for them, we started off by saying, what do you do when people tell you what to do? I'm like, you have to feed that need for people to feel autonomous and self-directed. And that goes for your patients as well as yourself. And so taking on the burden of your patients has not served physicians well in any way, shape, or form. And it's the same thing that's happening in the health system. In the health system, it's the paternalistic view that this group knows what's best for this group. And until we start flipping that narrative that people know what's best for themselves, or will make decisions and are accountable for those decisions, and then it's okay. You don't have to own it. And so when you have the skills to have those kind of conversations, it changes your mindset around what you're doing, and it adds to your identity. And when you actually focus on learning about you from an identity point of view, and then you go into, okay, what mental models are driving my identity, and you challenge those a bit, and then you add some new skills, that's deep change for physicians. And that's how we teach this program.
Interesting. Tell me about when you've had those conversations within systems, how is it received? What do you think the initial kind of reactions, and how do they put things into practice to be able to achieve something new?
That's a really good question. And I'd say it's mixed.
Even within a healthcare clinic, it doesn't have to be like
big system. Yeah, no. And a system is any group of people who work together. So, and it depends. I've had some groups that as they, I've had them where I just facilitate them and introduce a little bit of systems, and they struggle with it because there's that sense of lack of control. Understanding systems understands you really have very little control, but you do have control over certain areas that can have ripple impacts on systems. And how do you understand what those are? It's a very different way of thinking. Some really push back against it because they're uncomfortable with that lack of what they perceive to be more tangible control. Those groups tend to do not very well. The groups that have done some of the coaching work ahead of time and have done the personal work, the whole concept, it all starts with self. Groups who start with the coaching work first do much better. They, as a collective, understand how, because they have a better sense of self in many ways and better communication styles to unearth different perspectives and to learn and to grow, they tend to do better as groups. So the impact that you see, even though individuals learn these skills, the most powerful thing is when groups of individuals who work together learn these skills and then practice and apply them. That's where I see the biggest shift. You see the shift in culture, you see the shift in how people interact with each other. You see a reduction in burnout. We actually did a study with a group at the FMSQ in Quebec. And we found that using the Maslow burnout inventory, 90% of the items decreased significantly from pre-training to after training. And then another 30% of the items decreased again 3 months later. So these skills stick especially when you teach groups.
Yeah, it's fascinating. And it sounds like a core and necessary skill set that was potentially able to be taught years earlier, and all of us should know it.
Yes. Yes, you're absolutely right. The assumption is that people know how to talk to each other. And in many ways, people don't. And when you unearth the pattern of listening, just starting with the pattern of listening, physicians are taught how to listen based on ruling out different diagnoses. That's and it is ingrained. So if you think about how you listen to a patient, just take a moment and think about what's the pattern you use when you listen to a patient. What do you think? What does it look like? What do you think? What's happening in your brain?
It's things like fact finding, putting it within an illness script, trying that diagnosis pathway, trying to understand. But see, it's different from my perspective because I've obviously done some different work here, but I'm also looking for social context, things that might be a barrier to what I might need to implement later, and trying to get a sense of their environment and who they are in their space and time. That's what
Yep.
I'm doing when I'm listening to a patient.
Right. Now, imagine they've already made the diagnosis and they're figuring out what they want to do, and you have to help them do that. How does your pattern of listening change?
Previously, it would have been they should
Right. ...
So they should take these meds because I told them to. They should stop drinking. They should do this surgery. Why wouldn't they? The evidence says this is important for them. They should stop whining at me about their back pain because their back pain is going to be part of their life. I don't understand why they keep coming and telling me this. It was very much I can't understand, and I'm getting frustrated about this patient and why they just keep coming back and nothing's changed, right?
Yeah.
So that was the listening to their return visit and their objections to why they didn't do what I told them to do,
Right.
created an internal frustration and that constant lack of joy because I'm not seeing results for my patients, therefore I must be doing a bad job.
Absolutely. And so then your shift, now how do you listen to patients?
Okay, so it's so interesting when you drop the they should.
Yeah.
Now, the easiest example I've ever used when I'm trying to unleash this concept to others is when your alcoholic patient comes back and tells you that they're still drinking alcohol, you're not surprised and you don't blame yourself. Because you know how hard that is for a patient to truly, in the moment talking to you, they want to abstain and they never want to drink again, but take them 5 minutes out the door, bottle shop in front of them, their usual mates putting a beer in their hand. What do? They drink, right? So when I drop the they should and I say, what do you want? This is going to be the hardest thing you ever do. What do you think is going to make this easier? What's your first step here? If this is truly what you want, I'm here no matter what, whether you come back and tell me you're drinking or you come back and tell me you've stopped drinking. I'm just the helper. I will help figure out what do you need next.
Yes. And then this is where the coaching skills come in. That's the mindset you need. And then the additional coaching skills, be able to unearth, where are you now? How do you feel about it? Where would you rather be? How would you rather feel? What are options that you see in your life to actually be successful? How are you going to do that? And what do you have to know about yourself to be successful? That's all on them. That's not on you.
No.
And those aren't inherent skills in communication. And it's not how physicians are, back to your original question, like, these are not communication skills that people learn on a regular basis. It takes time, practice. You've dedicated your life to understanding coaching and how to be different. And that pathway you talked about is exactly the pathway we're helping physicians go through.
Yeah.
And we're adding on additional skills. Understanding your listening patterns, listening set-asides. How do you set aside different components of listening? How do you then respond in ways that demonstrate, I heard you? So a paraphrase, and a paraphrase isn't, what I heard you say is, that's parroting and it's super irritating, but it's about saying, it's about mirroring back. So for you, this is about really being authentic to yourself. That's a paraphrase. It's about saying it concisely, but using different words that'll just mirror back. And is this what you meant? And the patient, the colleague can be yes or no, and they can add on. And then it's asking questions that help to increase people's sense of autonomy, increase their sense of being more impactful, increase their sense of being connected to others in the world around them. Again, those human needs we have. So it's asking questions that support thinking, because all thinking every piece of thinking impacts behavior, but we tend to only focus on behavior. So the coaching skills help you as a physician to impact the thinking of a colleague, of a patient, of a student. And when you impact the thinking, you'll change a whole bunch of behaviors.
Love it. Love it. And so when you're working with physicians and clinicians, is that the starting with that internal voice of, I shouldn't do this anymore. Why am I still doing this, like running late or whatever it might be? That internal dialogue, that ability to shift what is within your control. Why are we making meaning around that sentence that you keep saying to yourself? How else can you move forward towards what you want instead without this judgmental attitude towards ourselves, for a better word? the
Yeah.
holding tight that you should have stopped drinking years ago to the patient, that you should have dealt with this years ago to yourself. Instead of having that judgment, you're like, okay, this is still happening. Tell me what you want to do next about it.
Yeah. You're almost referring to the play within the play.
Yeah.
As we teach people, how do you maintain that same stance in the way that you work with people? And yes, 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 and yes. Because, we often say, look, we're not the experts in being a physician. We know some things about communication, and this course and this time we have together is about you exploring them, you testing them, trying them on. And we have 4 key principles we use when we're teaching. The first one that's really important is opportunity for voice. We speak probably, like, we use a 10-to-4 ratio. For every 10 minutes we talk, there's 4 minutes at least of group talk. And that's because the group needs to socially construct meaning. They need to understand, how does this apply to them, and what fits, what doesn't fit, what have they tried, and they need to hear it from each other. So you create the environment where the group is teaching each other.
Yeah.
And it's co-constructed. Like, our homework is, we tell people to go have a coaching conversation and explore what you want to learn about questions in your practice next week. So they go out, we don't give them homework, they sort out what their homework is, and then come back and debrief it. So it's co-constructed. It's not given. And it is inherently about personal development. It's about that internal world, and how do you help support that internal world? So that's the approach we take, and we demonstrate and model it. We demonstrate and model the coaching approach in the way we facilitate.
Oh, wonderful. All right, I'm going to push a question that came up earlier. So government puts together policy and then feeds down, this is the guideline that we need to follow, or this is the model of pay we need to follow, or this is what we expect of you. And that pushback that comes immediately of, they don't appreciate me, they don't understand what I'm going through, they don't. Okay, so we're the tantruming diabetic at this point.
Yeah.
Give us some ideas on how it could look if we weren't so immediately threatened by those changes that happen, because they happen constantly, right? Little bit or a big bit, there might be a management decision, there might be a group decision, there might be a government decision, and we immediately have our hackles up, and they're like, and that you don't understand.
Yeah.
Piece, right? Yeah. What would it look like in that after phase? What would you expect that individual who's learned some of these skills to do when they have this come up against them, when they feel this from a colleague, from a system, from a management level?
Yeah. You're wondering how might learning these personal skills impact in times of chaos?
Yeah, or just in
Feels like
times of
everything.
change. If there's a
Time to
new,
change. Okay.
like the physicians right now in Alberta, where you are in the uncertainty, as we often are, of what is government going to do next? What are the rules they're going to put in front of us? What is the offer that they're going to give us that we're then going to have to pivot and adapt in order to work within that new system?
Mhm.
We don't know what it is yet, but we know change is coming. And when they've got that, and it's never going to be right, and I'm going to, and I'm going to be mad about it. So they're already pre-anxious, pre-angry
Yeah.
that even have to think about this, and it's all going to be unfair anyway. They're never going to get it right. And so it pulls them down as a collective,
Yeah.
or even individually, creating this potentially frustration, lack of joy, anxiety about their position.
Yeah. A
So I'm trying
very,
to think, if you've done this work, and I know how kind of I've watched my brain about change since I've
hmm,
done some coaching
yeah.
principles, and that's why I love the ability to look after my own brain now, which is wonderful. But I'm just wanting to hear how you would describe how an individual might meet that challenge.
Mm. It's a beautiful analogy you've actually shared how you manage your own brain. And I think you're right, because our brains are actually really stupid.
Mm.
Like an idea pops in and all of a sudden we're like, well, that's real.
Yeah. Yeah.
And so your brain does need management. Um, I think that there's a couple elements in there. Um, One is, and I've heard a very wise, one of my mentors, she's just brilliant. And she says, there's always choice in mandate.
Mm. Okay, there's always choice in mandate.
There's always
Okay,
choice.
that is a great sentence right there. I love that.
And so there's these guiding principles, understanding what guiding principles you need to help you move through these tough times. And, things like another one I've heard too is no, nobody comes to work to do a bad job. Even
Mm.
these policy people who we disagree with deeply, they firmly believe they're doing the right thing for the system.
Mm-hmm.
And the skills of being adaptive and not adapted come into play.
Mm.
And if you know what, I know who I am and I know what I do and I know what I believe in. So when this change is here, okay, if I know who I am, what I believe in and what I do, how do I do that and make choice within a mandate so I can
Mm-hmm.
manage in the environment, but still stay true to who I am? And that's the distinction I think that you can start to see in groups that understand how do you, and I'm actually developing two courses right now. Excuse me. One is for how do you have productive professional conversations as in groups of people in the face of uncertainty?
Mm.
Because people look for it all the time. They look for certainty. But the thing about
Mm.
being adaptive is you don't actually know where you need to go. Where you need to go is in the collective minds of everybody. And you as a collective need to explore that. So we're teaching physicians actually how to have meetings that attend to task, process, and relationship. And when you attend to those three things, you have highly productive meetings where people feel safe to share and you get broad perspective, which in the face of uncertainty, you need that broad perspective. And you need to know, who are we? What do
Mm-hmm.
we do?
Mm-hmm.
Why do we do it this way?
Mm-hmm.
And if you can do it in a different way and still be who you are, you're golden.
Yeah, I love that. So there is always choice. I can be adaptable within a new model, so long as I keep in mind, what is it that I value about this?
Yeah.
And how could I still do that within this new model? Or how can I be true to what I value within the
Mhm.
confines of that I'm being given or looking at, or considering?
Yeah.
Even if the group want to do something and you're not immediately on board, you can say, well, could I still do what I like to do, value within what they're saying,
Exactly.
rather than
And
immediately threatened, frustrated, anxious, dread?
absolutely.
All of
And
those are still valid. They're still going to come up.
still, absolutely. But the strongest inquiry or the strongest advocacy is inquiry.
Mm,
And we forget that. We often disagree with things we don't understand.
yeah, yeah,
So again, the coaching skills gives you the ability to ask questions to unearth people's thinking. And chances are good when you unearth people's thinking, it's going to be a totally different perspective than you anticipated. Because again, our brains are dumb. Oh, they're doing this. That means they must be A, B, C, and D. I hate them. Our brains
yeah,
are dumb.
yeah,
So having that kind of having those enhancing those thinking skills for yourself occurs when you help others also enhance their thinking skills.
yeah. Fantastic. I think this is really helpful because sometimes it can be hard to grasp. How can I be different? I am who I am.
Mhm.
Change is hard. Clearly, I'm not going to be able to do this. It's going to be too hard. But what you're saying is it's little steps. It's that insight of advocacy. You have advocacy towards yourself. You have choice within what you're doing. You have choice about how you are in the world and even the way you've interacted with patients for decades.
Yeah,
Everything gets to be explored, curious, without having to make huge changes, right? It's just that being interested in, is there something else that could help this be sustainable, enjoyable, lovely, part of valuing what I want to do and being who I want to be here. And then that ripple effect is it could make so much more about you, about your environment, about your systems that you work in.
yeah. You
Yeah.
have the impact to make change, and you won't see the impact of your change. You know that you've had the impact of being able to know your course can make significant changes and ripples in ways you probably don't even know.
Yeah. Oh, yeah.
And that's okay.
Yeah.
But you
Yeah.
know who you are and you know what you do.
Hmm.
And that's the important component.
Hmm. Yeah, love it. All right. So, in good news, we have you and your team coming to give a workshop for our members, but it's going to be open to invitation. We're going to be sending out those invitations to the people on my email list. Tell us what you'll be teaching
Mm.
that workshop.
Yeah, so we're going to actually talk about we're going to go through the basic skills of listening and paraphrasing. And we're not going to go into questions. Questions are a bit harder to
Yeah.
construct
Yeah.
in ways that maintain and don't tip that psychological
Yeah.
safety, because
Hmm.
questions can be very like
Confronting.
they're
Yeah.
really
Yeah.
impactful, but they can be impactful in bad ways. So you can do them in good ways. We're going to put that aside. That's a
Hmm.
bit of a harder skill, but we're going to talk about the simple act of how do you listen, unpack those listening patterns and allow people to really explore it. And then how do you listen in different ways? And how do you paraphrase? And what happens in conversations when you paraphrase somebody first? It's a magic. It really is a magic that because it tells somebody, I heard you, I understand, or at least I'm trying to. And is this what you're trying to say? And people feel validated, and that increases a bond between people.
Love it. Okay. So if you're interested in that, make sure that you get on the email list with my team so that we can invite you to that workshop. How do people get hear more about your courses, learn more about you? So how do they contact you, find you?
Yeah. So the company's called Thought Architects. We're on the web at thoughtarchitects.ca. We are going to be holding an open session for groups who would like to, or for individuals who would like to attend. That'll be starting in January. And that's for our coaching course. It's Main Pro certified
Mm-hmm.
um, for 38 credits and MOC Section 3 for 19 credits. So it's
Mm-hmm.
pretty good bang for your buck.
Yeah, totally. And that's the Canadian CPD credits for those of you who are in
Correct.
the US or Australia who are like, what's Main Pro? What's
Right.
Royal College? But they're the CPD credits for the Canadian physicians.
Yeah.
But if you have others coming in, they might be able to use those credits towards whatever they have in the US equivalent. So it's
Right.
all it's
Yeah.
all what we mean is great education.
Yeah. Yeah. It's been certified to be, effective, and we've researched it. We
Yeah, yeah.
presented at the Institute of Coaching at Harvard. We were invited to present, and so funny. I assumed everybody who submitted a poster got it. Turns out that wasn't the case. There was actually
No,
no. I didn't know that.
no.
No, I was just assuming, everybody did. That's why I'm here. But no,
Yeah,
we actually did because we showed how the coaching course decreased the sense of burnout significantly for physicians.
yeah,
And it was clear as day in our data and research. And that paper is going to be coming soon.
yeah.
So if individuals want to take the course, we can do that. We're having an open session in January, February to start. It is a synchronous course because, I always say you can't learn to ride a bike by watching
Mhm.
videos. And you
Yeah.
can't learn to have communications with people by not
Without
being with people.
true. Very true.
Yes. So we do it in 3 modules. The first module is 3 weeks, 2 hours a week.
Hmm.
Second, and then we take a break in between and you try things out.
Hmm.
It is highly all about you trying out things in your practice and then bringing it back and debriefing it and tweaking it and hearing from others. We do the first session on listening and paraphrasing. Module 2 is about a month later, same format, and it's all about questioning and the use of silence. So how do we use silence as a productive part of our conversation? And then again, take a break, come back, same format, and that's where we talk about professional identity and flow of a conversation. Um, and I have to say that professional identity one is like really cool. We had physicians come back after they were just in the breakout room talking about that, and they're like, nobody has ever asked me that question, and it has changed me. And
Yeah.
it's just really great. So I love the course. I love seeing how it changes physicians. I love how they try these things out. I love the sense of safety in the room.
Mhm.
Um, we learn from the group every single time.
Yeah.
Um, so yeah, that'll be in January to start. Probably towards the end, because I know January is always a little nuts. Um, and if you want to have your team come in, which is where we really see a big impact, we do sessions for full teams. It's a
Mhm.
fixed price. You can have up to 35 people in your group,
Mhm.
and just contact us directly, either at info@thoughtarchitects.ca or Margie, Margie, at thoughtarchitects.ca. And we can certainly look at scheduling some specific sessions for your group. Oh, and
Beautiful.
do this in French as well.
Nice.
Mhm.
Perfect. Anything we didn't talk about that you would like to let people know about or finish off with?
Mm. Well, I did allude to the second course we're creating. It's called Human Teamwork, and we're beta testing it right now with physicians. First session is coming up this Friday, so I'm a little nervous and excited. And it's teaching again that how to have productive professional conversations. So do look for that. It's an extension of coaching, but it's how you work with groups and teams. And working with people is hard. We should invest more time in how we work with people.
Mm.
And that piece of work will be coming up. And again, same thing. If people are interested in being, kind of as next round testers, let us know. We can do discounts on prices for that too, because we want to learn from the experience of others as we teach this work. And we don't just do it in a bubble. Um, if you have a project you're working on and it's not going forward, bring that project, because what we do is we help you work through that project by teaching the concepts. Again, there's task, there's process built on relationship. So
Mhm.
we teach the processes, we teach the ways that the processes support relationship, and you guys bring the task. So then we have a nice balance of all of it.
In the, I'm thinking this a slightly bigger system. Wouldn't it be wonderful if, wouldn't it be awesome if, I always love this question, wouldn't it be awesome if, dot, dot, dot. What if when a new government proposal came out, new model of the way we're going to get paid, new ideas on how we have to interact with this system, we had the opportunity as a group to do something like this, a workshop around, okay, here's the proposal. How are we all feeling? What's coming up for you? What ideas have you already had? What does it mean for you? What do you think it means for you? How do you see yourself interacting at this new level? What do you think they were thinking of when they put this out? The ability to vent and validate each other's immediate reactions, and then that systems and processes of how we're going to move forward within this and still maintain that value that we have for why we signed up for this in the first place. And where's our choice here?
You literally gave me shivers. That's the dream state.
Isn't it? Like,
Yeah.
why do we take this in silo and then we rant at each other, but not rarely. I'm starting to see more conversation about now what? Rant, immediate validation of this sucks, and then those conversations of, okay, now what? Where are we going to pivot? Where are we going to change? Because that pivot and change is what I do daily as a charting coach, right?
Yeah.
Is that physician coming at me ranting about some new policy, some difficulty they're having at work, and we say, okay, great, that's the environment. Now what? What do you want to do differently to be able to survive this and thrive in here and make it sustainable for you? Yeah. But it'd be nice to have it come bigger.
Yeah. Well, and I actually think it's coming. I think you're right. I'm starting to see more snippets of it too. But it takes the individual work first. And it is perfectly acceptable to rant, but know when the rant's over, and it's like, okay, over what do I have control?
Yeah.
And who are we? Who do we need to be in this new environment? And again, there's choice and mandate. We can't forget that. And the ultimate would be if that's how government did work. It's the way I did work when I was in government. We would go out and we'd talk to people, and we had a nugget of an idea. We had a problem. We said, okay, we have this problem. What are some ideas you have? What's leading to this problem? What's the scenario for to map it out? What does it look like? What are some assumptions? And then we develop the policy, and then we develop the supports. Like, that's how I worked in government, which again, that's very OT. Okay, there's a problem. I don't have the solution. You know where you need to go. What do we need to put in place to help you get there? That's the ultimate dream in my mind. I don't know if we're going to get there.
Yeah. All right. Well, maybe we need you to propose to the Alberta Medical Association that you want to run the workshop for when finally they give out the mandate of what's happening.
Oh, well, we'll see what happens in November, hey? And I also have to say, we assume things change greatly.
Yes.
On the day-to-day, you're still seeing your patients.
Yeah.
People will still come in.
Yes.
That clinical microsystem, the reason why you went into medicine to help individual people remains constant. So that's where in my mind, that's where the effort needs to be. How do I just stay true to who I know I am as a helper and get better in ways that I help, in ways that don't burden me? So to me, that's the internal work.
Beautiful. Well, thank you for this conversation. I think this is really helpful to be able to think about us within our contexts, and that there's opportunity for different within the context that we're working. So
yeah, for sure.
Love it. And thanks for the work you're doing in the world, especially given its significant impact and measurable impact. We were waiting for that. Let us know when that paper's out, and we can attach it to the podcast episode so you can go and read the research from Margie and her team. Wonderful. Well, thanks very much, and you have a wonderful rest of your week.
You too. Take care.
Bye. Bye, everyone.
Bye.
Thank you for being part of the Sustainable Clinical Medicine podcast. If you'd like to learn more or join us to help you get home with today's work done, go to chartingcoach.ca. There you'll find all the information on the premier Lifetime Access Charting Champions program that is helping physicians get home with today's work done, with all the proven tools, support, and community you need to create time for your life outside of medicine. We would love to see you there. Until next time, thanks for listening.